What is IVF? What are the steps of IVF? So this video will explain you IVF in a stepwise manner, one step after another step. Okay. So IVF literally means in vitro fertilization. In vitro means outside human body in the laboratory. So normally this process of fertilization happens in your body, in your fallopian tubes. So every month one egg is released from the ovary, which is captured by the fallopian tube. And if it gets fertilized by the sperm in the tube, then an embryo will be formed. This embryo will travel through the tube towards the uterus, and it will go inside the uterus and it will stick there, implant there, and this is how a pregnancy happens. In vitro fertilization means replicating the process of fertilization outside human body. So for that we'll need egg and sperm. So the steps of IVF are like this. First part is pre-IVF workup, wherein we do some tests for you, which include routine tests to make sure that your hemoglobin is alright, your thyroid is alright. These tests are essential so that we know that you are fit to undergo a procedure under anesthesia, and secondly, you are fit to carry pregnancy. Because if we find any problem, we need to take steps accordingly. Then after pre-IVF workup, the actual process of IVF or ovarian stimulation starts. Typically, it starts from second day of your cycle, second day of your menses. But in certain cases, in low egg reserve patients, or sometimes in fertility preservation cases, we need to start these injections premenstrually, before you get your menses, like 4-5 days before the actual date of menses. So that is called as luteal stim start. So we start the injections, 10 days of injections, 9 or 10 days. In between you will undergo follicular monitoring, ultrasound on 3 or 4 occasions. Some hormonal checks also will happen at that time. Then you undergo a procedure under anesthesia, which is called as egg pickup or ovum pickup, wherein we do a needle puncture through vagina under sonographic guidance under anesthesia, and we take the eggs out. Those eggs are fused with your husband's sperm. Your husband will be giving a fresh semen sample on that day, and the embryos which we form in that way are cultured mostly till blastocyst stage or 5th or 6th day of its life, and the embryos can either be transferred that time or they can be frozen. So most of the times, in more than 90% of the cases, the endometrium is not in a receptive condition for that embryo, or the hormones are high, so the chances of implantation are low, or the possibility of ovarian hyperstimulation is high. So most of the times we freeze the embryos. The patient gets her menses again. So one part of treatment is done, wherein we are making the embryos and freezing them. The second part involves transfer. For that we need to prepare the inner layer of the uterus, which is called as endometrium. So that preparation starts from second day of your cycle again, either by hormonal tablets or in a natural way we can monitor the growth of that endometrium. And once that endometrium reaches the optimum level, we plan the embryo transfer, start you on progesterone, thaw the embryo, take it back to the room temperature and transfer it inside your uterus, embryo transfer. So this process generally doesn't need anesthesia. And 10 to 12 days after this embryo transfer process, we come to know whether that embryo has implanted or not. That is checked by a blood test called as beta HCG. So this is all about IVF in a stepwise manner. If you have any more questions about it, you can ask in the comments below. And if you are not yet liked and subscribed the channel, don't delay it. Push the subscribe button now. Bye bye.